Presentation, and certainly will generate some questions. So we have about 20 minutes or so for discussion, and we will begin with questions and comments from Roundtable members. And if there is time, we'll open it up for broader discussion. I want to remind everybody in the audience once again that the workshop is being webcast, and a summary of the workshop will be published by the IOM subsequently. So I'm going to ask that if you have a question, please speak into the microphone. Identify yourself for an accurate attribution. We do have new members from the Roundtable, and perhaps it would be a good idea, since we are looking into the light, just take your name tag and put it up so we can all see exactly who you are. Okay, Ted, I'll open it up, but I have one question I want to ask you, and then I can open it up to the Roundtable members. Looking forward,
yes,
having perhaps 2020, 2025 vision, we'll give you a little bit correction. How do you think technology that you've just been talking about will look in the next 10 years or the next 15 years? And what documented effects do you think this technology will have on health, on chronic disease, on improvement of health in general?
I think we're at a great place to be right now. I can't think of, and I've been in the industry for 20 years, the health and fitness industry, and I've never been as excited as I am today about the potential of where we're going. You know, I grew up a Star Trek fan, and I always wanted a tricorder, like Mr. Spock had. That's available now, and it's a little sensor that you put over your forehead. So we're making things simpler to use, but my fear is that we don't have the science behind it. We don't have the behavior change. And that's what I think the next step is coming together, and perhaps it's IOM and this roundtable, creating a set of standards, creating opportunities to bring together Apple and Google and Microsoft to the table so we can be part of the solution. Because here's my fear. Apple and Google and Microsoft and these other companies are going to continue to exist. They're going to continue to push the envelope, and the general public will continue to use these. I want to make sure that we have the science behind that. And if I have a concern of where we're moving with it, that's what it is I want us, those that have been in the industry for years, to be part of the solution. And I think it can be done.
Hi, thank you for presenting about this stuff. It's a very, very fascinating, fast-growing industry, so it's great to hear and think about it. Michael Posh-Orlo from Boston University. So just to bring up something I think probably a lot of people are thinking about is that none of my patients with an A1C over 9 wear a Fitbit, right? And, you know, so a lot of this stuff is, for now at least, is for the wealthy, worried, and well. And so, in fact, there might even be a chance that this is driving an increase in disparities. So, so I guess it'd be great to hear your thoughts about how that could be shifted, how that could be changed. Because for now, right now, it seems that there is that risk, and I think part of the mission of health literacy is to see that would get reversed, that this actually can reach towards overcoming those kinds of problems.
You're absolutely right. And that's one of my concerns as well. The people that need the technology may not be using the technology because they can't afford it. You know, I look back, I've worn a Fitbit myself for the last 4 years. The technology really hasn't changed, but if you go out and you look at some of these earlier versions of the Fitbit, you can get them for much less expensive than they were when they first came out. There are tracker devices now that are available for under $20. There are, I did a quick research look, and I said, well, the people that really need this, do they have smartphones? Does the poorest congressional district in the U.S. in the Bronx, do these people have smartphones? And I did a quick informal survey, and it was a group of people, and I asked them. 80% of the people in the room raised their hand and said they have a smartphone. So it may not be that we need to have a tracker, but we might be able to use the smartphones, the things that are already there within our own reach, to be part of that solution. So I don't have all of the answers. I personally, and I want us as this group to be part of the solution. But you're right, and it is something we have to be careful about because we want to be able to be all-inclusive and not eliminate certain types of people.
Michael, that's a very good, astute question. The literature seems to say that socioeconomics does not deprive individuals of iPhones. I think maybe it's the health literate issue, the transfer of information, transfer of appropriate information that we need to spend some time thinking about, rather than whether you just can acquire an iPhone. So that's a very good question. Thanks.
I'm Jennifer Dillahay. I'm a new member of the Roundtable, and I'm from the Arkansas Department of Health. And your talk helped me make a connection in my mind. Recently, I read a book called Flourish, written by Martin Seligman, and it had to do with the kind of theory and measurement of well-being. He has a chapter in that book on chronic disease, and he correlated chronic disease with a psychological phenomenon that he called learned helplessness. It occurred to me when I was reading that chapter that health literacy, in a sense, could be an antidote to learned helplessness. And then while you were just talking then, it made me wonder if some of these apps could be used in such a way as to help people who don't believe they can have control or make a change, overcome that sense of learned helplessness and manage their chronic conditions. And I would be very interested in your take on that.
Thank you for the question. I haven't read the book, so I can't comment directly on that, but I agree with your assessment that these apps can be part of the solution. Here's a concern I have with apps. If you go to the Apple store or the Google store, there are thousands and thousands of different apps. And unfortunately, there's not a seal of approval. People can create apps and they can claim to be health experts or health literacy experts, but they may not be. So I would hope that in the future we'll have a way to create a stamp of approval so people know. I have AAA for car insurance. I know that if I go to a garage that has AAA, that there's a sense that I know that they've gone through some sort of training process or have a list of standards that they do. We don't have that yet. I see the potential and I see the speed of innovation from these companies. I also, as an academic and a researcher now, understand that we need a little more time to be able to measure the effectiveness. So I do think that these types of apps, they're simple to create, easy to use if they're done properly. So hopefully your solution will be one that will be seen very shortly in the future.
So Ted, I'm hearing a call for standards, standardization in this area.
I think there needs to be. There are a couple of apps that are out there that claim to do more than what they can. The one that I showed, the Gobi, it's a Russian company that came to the U.S. and they raised $1 million. I've got concerns with that because it's the snake oil salesman, right? It's the new version of snake oil salesman. And I think we need to have those standards. Who creates the standards? I don't have the answer for it. Who comes to the table as part of that? I don't have the answer for it, but maybe we as a group can create some sort of momentum to do that.
Lori?
Thank you for your presentation. I'm Lori Francis, member of the Roundtable and from Oregon Primary Care Association. So we work in Oregon, in my organization, with about 350,000 people who are living at 200% or below poverty, so that group that we heard referenced earlier. I think that I would love to hear a conversation today, and from you and others, Ted, about, I don't think it's necessarily the affordability of the smartphone, as you alluded to, but in fact, our priorities are not our clients' priorities. So controlling A1C when you're working 3 jobs or trying to get shoes for your kids or living on the street is not your top priority. So I keep waiting for an app that speaks to people where they are, not where we want them to be. Because what we know about behavior change is when we meet people where they are, including me,
Right.
I'm more likely to move forward. So while there is learned helplessness, there's also this arrogance on our part a little bit. We'd love them to control their A1C, but in fact they have more pressing issues. So how do we build apps that, because they do have smartphones, how are we respectful and connecting? And then I really liked, so that's one question, I really liked your comments about the peer-to-peer opportunities. One of the things I've been thinking about and heard recently at a gathering is this idea of disintermediation. So moving the former controller out of the middle, which I would say is the provider team, and what role can apps play in, and they are playing already, in connecting. I mean, it's not the physician who needs to hold you accountable for your exercise. Physicians know very little about exercise in general and nutrition in general. And I don't mean that disrespectfully. It's just that you're not exercise physiologists or nutritionists. So we always turn to the doctor to help us with chronic care in people who have issues that are not generated by lack of medical care, but in fact a history of many challenges. So just thinking about those connections as well.
I think this type of technology gives us a platform to be able to do certain things. I kind of think about going in for my physical, and the doctor says, I need you to do this, this, and this. Well, when's the next time I see my doctor? Next year when it comes time for the physical. So what if there was some sort of way that there was technology so you can include the nutritionist, the personal trainer, the chiropractor, the mental health specialist as part of that solution to help a person become more well. And I think that's what this technology can do. Kind of going back to your question about the end user, I think they need to be part of the discussion. We need to understand what they want and how they want it, and bring them to the table and say, help us design these apps and these wearable devices. Again, that speed of innovation is quick. We're not, I think about creating a software package, right? It's cumbersome, it's hard to do. For apps, it's quick. You know, many apps are still in perpetual beta because they're always changing. I mean, how many times if you go to your smartphone, you see it's time to download a new piece. So the technology is there to allow it to happen.
I'm Terry Davis. I'm a newbie also. I'm from Louisiana, one of the states that's always red on maps. I recently did some research with new mothers in a very low-income clinic. None of them had computers at home, but they all had smartphones. Mm-hmm. And they all had downloaded the what to do every minute you're pregnant, what's happening with the baby and stuff. But my question has to do with some of these women had low literacy and some of them were reading above a 9th grade level. I don't know what they did with that information. Was the information, could they use the information on these apps? And so I just wondered if you had any information about that.
I don't have any information, or I haven't seen any studies specifically to new mothers, but it's a very valid point.
The application piece, you know.
It's
What do people do with the information?
I don't have an answer. I wish I did, and I think that we need to find that answer, because that helps us create better apps. It helps us create better wearables if we understand what the people are doing with the information that they're getting.
So we have 2 microphones. I'm just going to try to organize this. We'll take Robert first, then Chris, and then we'll go back to the
Very
first.
good. Rob Logan, National Library of Medicine. I'm a participant in the Roundtable. I'm saying this now as a federal official. Standards means the FDA.
You're right.
You really want the FDA to take charge of this? What about having the industry itself take charge of it? What about engaging the news media? There's so little criticism independently of these apps, except by, I can think of one publication, Consumer Reports, that's very active, but that's it, okay? Isn't there other things you can do before going to a federal agency and asking them to take charge? Certainly, if you ask the broadcast industry, if they had to do it all over again in 1933, would they have created the FCC because of their own confusion, okay? I think you know what the answer to that question is. So let's talk about it, okay? You really want the FDA to be in charge of setting standards for all these issues and have the same kinds of challenges that have happened to other industries in the past? Is that the solution here?
No. I've lived in Washington for 19 years.
Then what do you want?
So, Robert, does standardization necessarily mean FDA?
It certainly seems to be that way, okay? The way it's been interpreted, okay? The way it's been popularly interpreted, there are other options, definitely, okay?
So we can reinterpret that?
Yes, we can interpret that.
Okay, that would be a good start.
Okay.
All right, you ready? Chris
Chris.
Desi, I'm a new member to the Roundtable. I'm from Bristol-Myers Squibb. Ted, I'm not sure, but I think Dr. McCoy handled the tricorder. I think you said Spock.
Well, they both did.
They did, didn't they?
They
Okay,
did.
That's what I thought. I have and I sort of aspire to this, I have what I call a dumb phone. Okay, and that's by choice in a way, but to go along with Michael, I think what you said about the folks who participate in this technology are different. I think they're already motivated, and that's nice. So I'm looking at this in the future because I'm going to die at some point, and this group of individuals with this technology are really going to dominate, and even the providers. So I wonder if we should start on working on interoperability for feedback to the providers, because frankly, we've been struggling with interoperability for the last 20 years, and I think we need to get started on it. Just your comments on that, in that this looks like this is just more information as a feedback mechanism to the, frankly, it's about patient engagement and shared decision-making also, based on the foundation of health literacy. I'm sorry, I threw a lot of concepts there, but interoperability is the key word, I think.
I was reading an article a couple of months ago that said that these technologies won't work until they tell us what to do. And I don't think I want a technology to tell us what to do. I remember back in my White House days where there was a treadmill that came out that would automatically change speed and elevation based on the heart rate strap that you had. I didn't like that. I turned it off because there can be problems. There can be challenges in the software. I don't want someone that can't run to automatically, because of a miscalculation of a heart rate, to start running 5 miles an hour on a treadmill. So there needs to be a discussion. There needs to be a way to create that interoperability. I am not well versed when it comes to patients and physicians in the healthcare. I'm coming at it from a different angle. So I would invite the others in the room for the rest of the day to have the discussions about how we can find the solutions for these.
Thank you, Mr. VIckey. My name is Winston Wong. I'm of Kaiser Permanente and also a member of the Roundtable on Health Literacy, and also on the IOM board on Population Health and Primary Care Public Health Practice. The reason I mention that is my question is relative to my participation in the board of Population Health and Public Health. Much of your presentation was really focused on wearables and the individual's relationship to an app or some sort of health monitor. My question is relative to the question of how health technology can facilitate public health. And case in point, we recently saw something that shouldn't happen in the 21st century, outbreak of measles. How would an app, or how would mHealth or health technology be able to facilitate the advancement of public health in a health literate way?
That question reminds me of something that I read during the flu outbreak, and there were people that could track the severity of flu by looking at Twitter posts and people tweeting about symptoms that they had, and they actually were able to map and see where the concentrations of flu outbreaks were happening by using social media. So this technology is opening up so many new ways of looking at things that we may not have done before. I go back to that mappiness example that I suggested, where through an app they were sending push notifications and finding out where people were and how they felt. Can we do the same thing when it comes to health? I think we can. I don't think we have all the answers right now, but through organizations like IOM and others, and bringing all of the stakeholders to the table to find a consensus, I think we can find a way to do it.
Let me see if I can just add a little bit to that. We're currently working on a program with the American College of Physicians called I Raise the Rates. The purpose of that is to raise the rates of immunization, specifically looking at perhaps flu, pneumonia, etc. I think that it requires more than an iPhone or something digital. It requires an educational process around that. It requires champions in a variety of different areas to, again, encourage the education, and that to get to the end user and the patients and the healthcare team. So yes, social media will help, no question. It is a means of communication. But I think it's the education and the champion and how that works around the iPhones, et cetera, that will make a difference, at least from what we've been learning over the last year and a half. Michael.
Hi, Michael Valaire, Institute for Healthcare Advancement. Thanks for the talk. And I wanted to build on a couple of concepts. One that Michael mentioned about the worried well and wealthy. I'm probably at least 2/3 of that club, worried well and chubby, but which is why, I wear a Fitbit and I, try to track what I do. And then also on Jennifer's concept of learned helplessness. The technology and the apps, those are great, and they're interesting, and they're exciting, and I like using them, and they're very fascinating, but we found out that the American population sometimes has a very short attention span, and it's till the next new, bright, shiny thing comes up, and ooh, look at that, and we're suddenly off to something else. I'm a little concerned, and I'm just curious if there are conversations in your space going on about this hidden or missing what would we call it, a skill set about actually understanding some of the health choices that we make. So for instance, the app that scans the food and gives you a score, that's a great tool. But when it replaces our own ability to look at food and make a choice, is this a good choice or not a good choice, can actually be very disempowering when we don't have our device with us, and we're looking at a pound of 30% fat ground beef versus a pound of lean chicken breast, and there's no way to scan those. How are we able to make those decisions if we've been relying on the app to make those decisions for us? And so I'm just curious how that notion's trajectory plays out with future generations, with children who are the digital natives and the ones who are using these technologies. As time goes on, is there a missing piece which is kind of right in my mind in the heart and center of health literacy, which is understanding the information so that you can apply it to make your health decisions?
I think there is. Let's look at some of this information like the Fitbit. I've taken over 7 million steps. So what? And I think what happens now is that a lot of this data is in a data silo. So I have my step information here, I have my blood pressure information here, I have my food journaling here. But what I'm seeing now in the industry is finally some interoperability of people coming together and being able to see that information as one. What's interesting is when you take your car in to get it serviced, the first thing the mechanic does, it plugs it in and runs a diagnostic. These types of technologies may be that solution for us to be able to have a diagnostic. So when I go into my physician's office, I can give all the information and find out that the problem I'm having is because I'm not sleeping well the night before. I'm working on a project with a middle school in San Diego where they're hoping to outfit everyone with a Fitbit, not only for health reasons, but they want to see the heart rates of the kids when they take tests. They want to see how they sleep before a big test, and use that information as part of a whole wellness program. So again, these are tools that we can use. I think if we spend some time in creating the opportunities from these tools, we'll be able to answer some of those questions in the near future.
Just to keep us on time, I'll take a last question from the microphone, and then we'll tap the next panel.
Hi, my name is Alicia Fernandez. I'm a new member of the Roundtable. Found the presentation fascinating. I'm also a primary care physician at San Francisco General. My patients are very poor, very poorly educated. I have often I wear a Fitbit, and it's been very helpful to me. And I often recommend to my patients that they buy a cheap pedometer from Walgreens or a local pharmacy. And many of my patients have done so, and they all come back, and I say, how is it going? And they say the same thing. It was too hard. I couldn't figure out how to use it. And my question is about as you go around using, and it's interesting that my Fitbit which is much more expensive, is much simpler to use. But my patients cannot use, and most of my patients cannot download an app, even if they have a smartphone. So my question is about the interaction with the healthcare system. I want to be able to prescribe a pedometer to my patients, but someone needs to set it up. Someone needs to be able to download the app. Someone needs to be able to show them how to use it. And in your conversations as you go around, I am curious whether people are seeing the role of a medical assistant informatician or a pharmacist informatician or someone who, however we denominate them, who would be the person who would help the patient, much in the same way that I have someone review the medications with the patient after I have finished reviewing the medications with the patient.
I think you've just created a new job I'd love to have. I talked about this at the beginning of the year, and I suggested that health clubs and fitness centers and personal trainers should offer people that get a Fitbit or a device the opportunity to bring it into the club and have them set it up for them. It's a challenge I face with my dad. My dad has problems downloading apps, and unfortunately I don't get to see him as often as I like, but when I'm home, that's what I'm doing, and I'm doing it for him. But I think that there's an opportunity to be able to have someone in a doctor's office, in a health club, in a Walgreens, to be able to download these apps and educate people on the wearables. We've talked a lot this morning already about different things in different areas, and what I hope will happen for the rest of the day is through the panel discussions is we may not have all the solutions when we walk out of the door here at 5 o'clock tonight, but at least we'll have some conversations, and we might be able to have some concrete ideas to be able to move forward. So I'm honored to be able to start, and thank you for having me.
Ted, it was our pleasure.